My name is Dr. Ernst von Schwarz. I'm a cardiologist and internist, and I'm a user of telemedicine. Not only in the current COVID-19 pandemic crisis, where it enables us to avoid patients coming in to the clinics, but we can communicate with them directly from their home using different ways of media, whether it's Skype or FaceTime, among others, or sometimes just on the phone. So we can see the patients, we can talk to the patient. They don't have to find a driver to bring them to the office clinics. They don't have to have waiting times in the waiting area, sometimes an hour. It enables much easier access to the patients, and it enables us as physicians to follow up our patients much more frequently. So this is not only the beginning, but this is basically the beginning of the future. So I do foresee significant increases in usage of telemedicine in the very near future. We have done that many years ago in Texas, for example. I did telemedicine with all the prison systems, with the prisoners in all prisons in the state of Texas, basically connected to us at the University of Texas Medical Branch. We could see them, we could evaluate them over a phone, or over video, oftentimes with a nurse on site. So now and in the future, that will definitely increase because it is so much easier access to the patients, and for the patients, easier access to us as physicians. So patients don't have to wait in waiting areas. So we use different technologies already. For example, if someone has a pacemaker or defibrillator implanted, we can assess those devices via media, via the internet, and we can interrogate those devices without patients coming in. But in the near future, of course, we want to use much more technology. We provide patients with electronic stethoscopes that we can listen actually from the office to the patient's heart in their home, as long as that device is connected. We can provide cameras in the patient's home. They don't have those, so that we can see and inspect the patient, look at certain areas of interest in their bodies after surgeries, for example, to inspect the wounds. That does not, of course, replace a complete physical examination, but it helps, and it helps the patients in particular and us to communicate much more frequently and easier with the patients in general.